this new strain seems to be very, very contagious. It seems to be transmitted very quickly. And I think India has the perfect storm. It's multi-generational families living under one roof. It's people who are living in crowded conditions, and it's people who for a very long time were not masking and went to some super spreader events that I think took these strains across the country. So I think it's a perfect storm of what could go wrong with COVID, and that's what you're seeing now. So we need to step in. We need to stop the strain from spreading to other areas if we can, and try to keep the people who are not needing the hospital at home as much as possible.
It was really only about 2 weeks ago, maybe 2.5 weeks ago, that the news started coming out of India. And luckily, Pratham has a team that spans India, both rural and urban areas. And so we were able to quickly get real-time news and real-time data and facts, as Pratham always does. And unfortunately, the situation was just as dire and tragic as the media made it out to be. So with this data and news from real-time frontline workers at Pratham, we were able to quickly put together a task force here in the US of a lot of our board members and national people across the nation to figure out how best to serve this problem in India. And based on initial discussions with medical staff, it turned out oxygen was literally the #1 issue and the issue of the day. So our task force just quickly figured out how could Pratham use its resources best to procure and distribute oxygen within India. And just to spend a minute, there's really 2 sources of oxygen. You can either build a plant and allow people to bring cylinders and fill up the cylinders and take it to hospitals, or you can provide oxygen concentrators. And I think both work well. The unfortunate thing with the oxygen plants is, 1, they're expensive. Number 2, they take a lot longer to set up. And number 3, the hospital infrastructure at the smaller and rural hospitals aren't necessarily set up for oxygen plants. So we quickly moved our focus to oxygen concentrators. The great thing about these oxygen concentrators is they're mobile. They require a lot less infrastructure. They can be used in hospitals, at home, and even mobile settings. I'm sure you're hearing news of patients being served in automobiles, and oxygen concentrators can work there too. The only real infrastructure required is electricity for them to work. So once we started getting into this, it turns out China actually produces about 90% of the world's oxygen concentrators. So in a matter of about 24 hours, we put a procurement team together with people on the ground in China to help us out with this.
So the leg 1 of the strategy, which was rightly identified by Pratham USA in conjunction with Pratham Education Foundation, was oxygen concentrators. And that's where we have done, I think, fairly good work. What is now required as far as India is concerned is a set of medical equipments. Some of them are quite expensive, and we also need to make sure that we have people on the ground who can deploy them correctly. So whether they are PSA plants, whether they are oxygen cylinders, whether they are pediatric ventilators, whether they are BiPAPs and high flow nasal cannulas, HFNC machines. Besides that, as you know, Pratham works in many communities, but also does a lot of work as far as skill building is concerned. And in the last few days, we are discussing with some other partners, whether it's installation of medical equipments, whether running of the medical equipments is concerned, maintenance is concerned, and also repairs. If we can create a team of people who can, throughout the length and breadth of India, with the training that they get from the vocational centers of Pratham, we can create a cadre of people, and somewhere that will be equally important. Definitely we need money, definitely we need equipment and medical supplies, but we also need human resource to deploy these things.
There is always going to be an intermediary NGO or an organization that will be in between the organization donating the concentrators, and finally the facility that is going to use the concentrators. We are working with this particular organization or these organizations who would be in between to collect data periodically every month on how the concentrator itself is doing and how many patients have come in, how many patients needed oxygen in that period. But we are also looking at some metadata to see the impact of the concentrator that we are bringing in. The first thing is that we are looking at what we typically refer to as L2 beds, level 2 beds, which are beds which have got oxygen supply in them. What was the number that we had and where have we reached after putting the concentrators in? The other thing that we are going to look at is the case fatality ratio, and primarily to try and understand if we have been able to dent that. We understand that there are multiple factors that will be impacting that, but probably right now oxygen supply can be one of the important things looking at that. So we have set up a tracking team at Pratham, a team of people who are reaching out to these hospitals and organizations and collecting data every month. The idea here is to not overburden the healthcare facilities with data reporting and things like that, because we know their focus should right now be on serving the patients. That's why we have set up a team on our end who will be reaching out and making sure that whatever data that we need for reporting is collected. And simultaneously, we have also set up preemptively some mechanisms of repairing the concentrators if in case there are any issues that come up with the concentrators itself. So I think in the days to come, there will be much more details on how these are being used, and we'll be sharing that periodically. But once again, want to thank the quick thought that was put in and the efforts over the past couple of weeks to bring in much needed help. I would now actually want to switch to another need, which is probably going to help us avoid the third wave, as everyone in India is seeing that's going to come, or at least minimize the impact of it. And that primary need is awareness. And we are at Pratham, we are trying to come up with our own ways to the communities that we have reached in, the digital initiatives supported by the Sir Mangal Family Trust that we have started, and the content that we are creating, how all of that can be leveraged to make sure that we can spread awareness and make sure the impact of the third wave is taken down.